My name is Amanda Hernandez, and this is my honors final project, Health Inequity, America's Chronic Condition, a speech analysis for honors public speaking. Childbirth should be a time of new beginnings, but according to the Centers for Disease Control, this is not true for Black women, more than any other ethnic group in this country. Dr. Esteban Lopez says, Black women have a 3 to 4 times higher likelihood of having what's called a negative birth outcome. That may include a premature infant, a lower or low weight infant, or their child dying from what we call all-cause infant mortality. This quote comes from the speech I will be analyzing today. The speech was given by Dr. Lopez in 2017, and its primary focus is health inequalities for Black families in America. In my analysis, I will employ neo-Aristotelian criticism for my methodology. This criticism best fits for the speech because I'm able to prove the effectiveness of the speech based on the 3 appeals. My sources for research on neo-Aristotelian criticism are from professors in the field, and their findings are as follows. For Professor J.A. Hendricks, he maintains that neo-Aristotelian criticism is useful not just in breaking down the immediate subject, both historical and judicial, but that it further holds value for a utilization in seeing the bigger picture. Professor Gerald Phillips describes neo-Aristotelian criticism as multi-applicable to any and all subjects for analysis. And Professor Judy Siegel crowns neo-Aristotelian criticism as the default form from which medical professionals are trained in, and that those in medicine make the most use of for presentations, whether they're written or spoken. The Aristotelian appeals are the foundations from which I will present the proofs of why Dr. Lopez was an effective speaker in his presentation. His goals to use his speech to inform and provoke feelings of connection as well as hope were met. Here is a slide that shows why it is so important for this topic to be discussed and why Dr. Lopez felt it was so pressing, because there is a huge, stark disparity between those most impacted by pregnancy-related mortality, by race and ethnicity. I'm going to move into the analysis, showing why Dr. Lopez is most effective. His goal is to use the speech to inform and provoke feelings of connections as well as hope, and he met all those goals. Dr. Lopez is effective in ethos, his character, because he speaks from a position of credibility. Dr. Lopez was effective for pathos appeal because he uses sentimentality as a means of carrying lots of emotional weight in his vocal and visual aids as he gives his speech and he varies his intonation in his voice. Dr. Lopez is effective for the appeal of logos because he came with statements on health inequity and he provides the proof for both the problems and for the solutions. It is important that the character is valid and credible because it deems their arguments worth. For this speech, Health Inequity, America's Chronic Condition, there's a link online to view it, and it gives a description of who Dr. Lopez is. It lets us know he's a board-certified physician in 2 specialties, both internal and pediatric medicine, that he's won many awards and achievements, and also that he is the leader of an insurance company focusing in the area of public health. And he's been a physician with over 12 years of experience in a very populated area of Texas and San Antonio. So when Dr. Lopez says, as a pediatric doctor and as a parent, I know all too well the stress, the heartache, and fear associated with having a premature infant. When he says that, his words carry value and relevance because of his experience and expertise. He is an effective speaker on the subject and a credible speaker on the subject of Black maternal fetal medicine because of this. For pathos, emotional appeals used to provoke reaction. Dr. Lopez is really, really good at pulling heartstrings and making sure the listener feels something about the content he's presenting. The doctor uses photos of real persons, a personal friend and her child, and talks about them as someone he cares about. And that's so that it's not just statistics that are kind of abstract, but to prove that, look, these are real human beings. It could be someone you know. They're just like you. But the odds are stacked against them because they experience this huge inequity on account of racial bias in medicine. So he shows that the statistics of suffering and how bad it is compared to the rest of the population. And he pauses. He makes his voice serious, and then at other times he pauses and he asks the audience to think about it. So he does use the way that he talks to get an emotional reaction. He even gets the audience to laugh at the very beginning just to get them to connect with him by opening with a quote from the Hunger Games movie about the odds of survival in the fiction. Then he goes immediately into connecting the idea of odds for survival and applying them to the reality of how unequal access to medicine in this country means that the odds are not in favor of many real human beings. Another joke that he makes to get the audience to connect to the humanity of the population that he is speaking of is a joke about the innocence of the child who survived Black health disparities in being born early. He also gets the audience to laugh when he's talking about how stressful it is at that time of the year in 2017 when many people in government were fighting against expanding healthcare access. And he kind of capitalizes on the emotions of the listeners by inviting them to take deep breaths with him and to exhale, just to kind of get calming, just like he's trying to calm himself down while he is trying not to stress out about the fact that people are fighting to mitigate and stop people from getting more access to healthcare. And he invites them all to do something about it. And he gives them hope that they can do something about it as he goes through it. So pathos is a huge part of his speech, and he does it well and effectively, and he definitely meets up to all that is needed in provoking emotional reaction. He is fact-driven. In his logos, the arguments are effectively proven. Dr. Lopez includes in his arsenal all of his personal experience as a practicing physician who serves the populations that he is speaking of, those that are in Black families that experience the negative birth outcomes. And he brings his access to the studies, statistics, and data to prove what he is saying. He's effectively able to argue the proof for the existence of Black health inequities in childbirth with these peer-reviewed scientific medical journals. And he backs up all his statements. He shows that Black women are experiencing health inequities at alarming rates. And again, I'll go back to this statistic here from the Centers for Disease Control that show just how many more the Black community is experiencing compared to the rest of the population. And this is one of the things that he brings up. And he proves and backs up. He also proves that they experience higher levels of racial bias and that this is not something that is happening to them because they are Black, because it is in their genetic disposition. He brings an epidemiological study on Black immigrant mothers who, when these same Black women were in their country of origin and gave birth, they gave birth mostly, majority of the time, to healthy, full-term, healthy weight babies. But when these same Black women immigrate to America, he says in one generation, their daughters are going to have birth outcomes that are equal to the general African American population in America. And this is terrible. And he has the proof to back it up, which he does show in his slides. So he is very effective at meeting all of these appeals, and it is why he is an effective speaker. This is the lens which I'm used to analyze his speech. So he's a credible speaker. He's able to make human interconnection and a logical appeal. Implications. So what now? After he's given all this information and this long speech that really well begins and ends and closes with a bunch of messages, I think that the implications now are that Dr. Lopez argues for the need of greater awareness. More people caring about the humanity of the people that are affected in these studied data and statistics need to educate and share the information so that more people know and we can do more about it. These racial bias problems in medicine only exist because of the dehumanization of Black families of their entire ethnic group based only on the color of their skin. And there's a lot of historical and systemic problems that are contributing to this. So the population at large and the greater medical community need to know more and need to do more. Dr. Lopez says in his speech, we have to treat patients in a culturally competent manner and recognize that racial bias affects their health. But if we don't recognize it, we don't know it's there. Racism in medicine against the most marginally affected in the Black community is a problem that will only go away if enough people take it seriously and care. Some of the things that he says this has to be personal. You have to make it personal for you so everyone can do something about it, not just people in medicine. He says raising awareness, voting for policy changes and for representatives that care about this issue too, getting involved in one's own community and making sure to hold those in power, not just in government, but those that directly care for these vulnerable populations are also held accountable. And this is just some of the ways that Dr. Lopez recommends that we can reverse the course of the violence of racism in medicine. My conclusions are that it is possible to have systemic equality. We need more people that are speaking up and doing more, and that no one deserves health inequity. And my conclusions are very much honed by my own experience. I have been a medic in the Houston area for about 12 years. And I chose this speech because Dr. Lopez is an example to me of a fellow Hispanic medical provider who cares enough to be a voice for those he's serving and prioritizing those who are affected the most, which at the moment are the people in the Black community. I hope one day to join him in being a voice for the suffering witness and in order to help change lives. And him making it personal is so important because I think people need to think about it. Right now at my current job, I serve a very specific population, and I work for a pediatric transfer ambulance. The children that I see are the most ill I've ever worked with. They live on ventilators, pumps, machines, just to keep them alive every day, and they're so ill that they can only leave the house with an ambulance and a nurse and a team to help them remain stable while they go to and from their home, to their therapy, their doctor's office, wherever it is they need to go in the hospital for treatment. I will preface with a warning that I will be explicitly describing the reality of consequences for Black women and families that I have witnessed in my career on account of the reality of racial bias in medicine. One instance was a woman who came into the emergency room I was at. She was in labor and didn't even make it upstairs to deliver in the labor and delivery area. She had the baby right there in our ER, and the baby was born not breathing. They were stillborn. And later she would die in the ICU of the same infection that took her child from her before she could even meet them. Another instance that I can think of that really sticks with me is when I'm transferring a child by ambulance and the mother will be scared of another bill for the ER because it costs so much to keep a kid alive, when something as simple as having spit up as a baby leads to them almost dying, and we're having to make that decision of where are we going. And the only thing they should be thinking about in their moment is their child, but with me in the back trying to keep their child stable and do everything I can, CPR, that mother is afraid of not being able to afford to keep her child alive. I believe that if we had more caring providers like Dr. Esteban Lopez focused on preventing the complications of racism and accessibility in medicine, so many lives could be saved and so much suffering could be prevented. The woman and her stillborn child could have lived. The mother who was crying, unsure she can afford to keep her child alive, would not have had to go through that heartbreak. I believe that if we had more providers doing more. The many other Black families, like these families, who make the markers increase on the statistics of their suffering, could be brought down, could even be stopped. For all the darkness and despair, there is hope. Hope that if more people raise awareness, educate, take direct action, that suffering on account of racial bias might be mitigated and eradicated. Health inequities are not an impossible solution, says Dr. Lopez. In this speech, he effectively gives hope that if more people do something, then more things can change when it comes to racial bias in medicine. Working toward a systemic equality is possible. And you shouldn't have to see it with your own eyes like Dr. Lopez or like myself and the many other medical providers to understand and want to do something. Dr. Lopez effectively shows that it's possible to connect the issue at hand with the population at large with the power of a well-given speech. With more voices and actors in and out of the field of medicine, we can ensure reformation. Everyone deserves equal access to care. Dr. Lopez closes his speech saying, because in doing so, we allow Black families the freedom and liberty to live the lives they want to live.